Clinical Network Provider Training. On behalf of the Center for Practice Innovation, the National Center on Addiction and Substance Abuse, and our co-hosts, the New York State Health Plan Association, and our state partners from OMH and OASAS, we'd like to welcome you and thank you for joining us today. Just a few housekeeping notes before we get started. I'd like to just let everyone know on the line that if you'd like to speak, all of your lines have been muted, and in order to speak, you need to hit *1 in order to unmute your line. And please remember to hit *1 to mute your line when you're done. So let's get started. We'd like to welcome everyone and thank everyone for joining us today. As you may know, the Uniform Clinical Network Provider Training is a new training that we are offering in collaboration with our state partner agencies as well as the New York Health Plan Association. I'll just take a few minutes to outline what we'll cover on today's webinar. And we're certainly very interested in hearing from folks that have joined us today and are looking forward to the conversation and the dialogue with our early adopter agencies as well as the participants on the line. So a few things that we'll cover today. We'll tell you a little bit about what this training is. We understand that there may be agencies who have enrolled in this training as well as those who have not enrolled in this training. So we're really trying to be available for any questions from participants and from people who have not enrolled or registered for this training yet. We'll cover some of the topics in the curriculum, and we're really seeking feedback from folks on our curriculum as well as topics for our future curriculum development. We'll review some reporting aspects of this training, and we'll also hear from agencies that have really taken this training on and contextualized it within their organizations and hear from them about how this has been experienced and used within their organizations. And then we'll provide some question and answer period at the end. Before we dive into details, though, I'd like to invite our state partner, Dr. Tom Smith, who's Associate Medical Director of OMH, to just say a few words and give us some background on the training. Tom?
You want me to start?
Please.
Okay. Thanks, Sapana, and thanks everybody for taking the time. I'm Tom Smith. I'm with OMH, and I've been helping OMH to implement some of the Medicaid reform changes over the past couple of years. And as everybody knows, there's a lot going on. We've had health homes, there's DSRIP, now there's this big move towards value-based purchasing, which is really changing a lot of what we do. And there's a big shift towards quality and performance measurement approaches. So tremendous amount of change going on. The managed care plans are in the middle of it. And we've said this before, many of you may have heard me say it, we are looking for a different kind of managed care now. We're not looking for the older version of managed care, which really focused on utilization review and does the person meet medical necessity criteria. We're not looking for that. I mean, there is some of that, obviously, but what we're really looking for is the managed care plans to leverage all of these reform initiatives and really help preserve key elements of our vision for the behavioral health system of care and our goals for behavioral health providers as we shift and hopefully transform in a desired direction, this system of care. So hopefully you guys are all experiencing better relationships with managed care plans than you may have experienced in the past. If you haven't, we want to know about that because we really want to hold them to this and get them to be our partners here. Now, we noticed early on when we were developing the managed care implementation plan that the managed care organizations have a requirement in their state contract, the contract that New York State has with the plans. And the requirement is that each managed care plan has to, in a continuous manner, survey its provider network and identify clinical training gaps and clinical training opportunities, and the plans have to provide these opportunities. Now, we saw that, and we thought two things. We thought, well, there's a real opportunity here for us if we can work with the plans to identify a uniform approach to training opportunities. We also thought, oh my God, with 10 plans in New York City and 20 plans statewide, if 20 different managed care plans have 20 different provider clinical training programs, that will overwhelm our provider system. There's no way providers will be able to keep up with these different requirements. So because of those two observations, we decided early on that we wanted to get involved, that the state wanted to get involved and collaborate with the plans and the plan association to have a uniform clinical training program for providers that meets the plan's obligation in their contract and also meets the state's goals for being able to set the minimum standards and offer training opportunities for providers as we navigate all these reform initiatives. So we got together with CPI and CASA and OMH and OASIS worked together, and we engaged the Plan Association, who's been very, very helpful and played a great role here. And we've developed this uniform network provider clinical training program. It's sort of a two-tiered program over time. Now, some of what I'm going to say might be speaking more towards the future because we're putting this together, but I told Sapana I wanted to have a chance to talk about how I saw this evolving over time. And we're envisioning sort of an ongoing platform of core competencies that are identified on an annual basis and identified based upon an advisory program where we get input from you all, from providers and obviously from the plans. And on an annual basis, we identify sort of core clinical areas where we want to target training opportunities. Maybe we need to do more next year, for example, related to the opioid epidemic. And so we'll be responsive to what the needs and issues are of the day, but identify some core competencies and make sure that we have a good menu of training programs for providers and put those out there on an annual basis and then help and track how providers are doing. And then above and beyond that, I think we want this training program over time to be an opportunity for providers to really contribute to their own profile of areas of expertise. We are not expecting that a training program like this is going to standardize provider training and provider competence across the state, and that every single Article 38 or 31 and 32 program is going to look exactly the same in terms of what they do and how trained up their staff are. That's not what we want. We want providers to retain their individual focus and areas of expertise and goals, and we want to have this training program evolve in such a way that above and beyond some core competencies, there'll be opportunities for providers to pick and choose from menus of other training and other activities that they can pursue and have that documented through this program and have provider profile reports that show how programs are unique and have specific competencies. So again, that's down the line a little bit, but that's what we've challenged CPI and CASA to think about with this program, and we want to get your buy-in to it as well. You'll hear more now. I'll stop in a second, but our goal is to have, obviously make these training programs available and offer things like CEUs, continuing education credits, so there's incentive there. But we're hoping that one of the major incentives will be the availability of these provider profile reports that document what kinds of training activities your agency and your clinicians have pursued. These reports should be of interest to the managed care plans who might be able to use them in credentialing activities down the line. We're hoping that they're of interest to you, to provider agency leadership, because it gives you a good snapshot of what your clinicians are currently competent and trained up to do. And again, we hope you see it as an opportunity to build and market your brand as we create different kinds of reports and diversity within individual reports. That's down the line. So hopefully this is one of those proverbial win-wins for plans and providers. If not, if you don't see it as value added over time, we want to know and we'll make it better. That said, we appreciate again your time, and I'll stop with that, Sapana.
Thank you, Tom. I'd like to turn it over to my colleague Marcus at the Center for Addiction and Substance Use at CASA to describe just briefly our collaboration. Marcus?
Thank you, Sapana. Once again, my name is Marcus Doherty, and I'm from the National Center on Addiction and Substance Abuse, and welcome to this webinar. I'd just like to take a moment just to acknowledge that this webinar is actually a collaboration between the Office of Mental Health, the Office of Alcoholism and Substance Abuse Services, as well as CASA, CPI, and the New York Health Plan Association. I'd also like to take a minute to acknowledge our Plans Association's co-hosts who represent the following plans: Health First, Beacon Health Plans, Capital District Physician Health Plan, and Empire. So thank you. Okay, and of course, our most important collaborators are our provider agencies. So we'd like to take a moment to highlight some advantages of this training. One, it's available online at the provider's convenience through the CPI Learning Management System. Providers may receive continuing education credits, and for agency directors or supervisors, summary reports of training activities may be provided to support internal, continuous quality improvement. And now you'll hear more about assessing the online training from CPI. So, Sapana?
Thank you, Marcus. So I've just put up a slide here to describe to folks that are on the line how to access the online training through the Center for Practice Innovation's Learning Management System. Now, some of the Article 31 and 32 clinics that we've invited to participate in this training have had the experience of taking training through the CPI LMS, and there are others who may not have taken training through the CPI Learning Management System. So if it is the case that you already are in the CPI Learning Management System, and many of the PROS programs that we have also invited to participate in this training are enrolled in our Learning Management System. If you are already enrolled, you may go access the training on our home page through our Network Provider Training button, and the next few slides will provide illustrations of that process. In the case that you are not already enrolled in the Center for Practice Innovation's Learning Management System, we have set up an enrollment survey that is online and available on our CPI website, which is practiceinnovations.org, and we can certainly reach out and provide you with more information. But this online survey would need to be filled out by program supervisor or agency leadership, and then the Center for Practice Innovations would then reach back out to you with instructions on how to register for the training. As I mentioned, this training is available through our learning community, which is another way of how we refer to our learning management system. When you go to the home page, as you see by the red arrow that's indicated, you may access all the trainings on the Uniform Network Provider Training button. When you click on this button, it'll take you to a list of different network provider training parts. We are delivering trainings in different parts iteratively throughout the year. And once again, as we've said before, we have assigned continuing education credits for all of these trainings, and when they become available, providers may take these trainings and receive CE credits. Now I'll turn it back over to my colleague Marcus, who will talk a little bit about what topics and what clinical training and evidence-based practices we have in each of these training parts so far. Marcus? So this slide will give the agencies a sense of what curricula we have in each of our network provider training parts.
Oh, hello?
Marcus?
Oh, yes. I'm sorry. I was muted. I apologize. So just to briefly discuss the slide that's up now, this slide just gives you an in-depth look at some of the training topics, which include motivational interviewing, cultural competence, ancillary withdrawal and stabilization, and suicide prevention. So providers are encouraged to complete the trainings over the course of the year, or by June 2018. We also anticipate that between 10 and 12 hours of training total over the course of the year. So over the course of the year, it should take about between 10 and 12 hours of training total. Okay, at this time, we'd like to take a minute to open it up to our audience and ask about any topics that may be of interest and invite you to respond using the chat box. So if there's any trainings of interest that you would like to see, at this time we ask that you please include them or put them into the chat box. Okay, and we'll give you folks a few minutes to do that.
So I see we have a few topics coming in. Addressing engagement into care, no-show rates, need training for supervisors and how to manage staff, engagement into services beyond MI. I see we have a question coming in about how to manage staff in the CPI system, and we'll review this in just a moment. What I can say is that as a supervisor, if you're in a supervisory role, you are able to assign training to your staff within the learning management system. We would just need to know at CPI when you register who the staff that you would like to supervise are, and you would be assigned a supervisory role. Okay, I see another question. Are all trainings in each part mandated to be completed by provider staff by 6/30/18? Are all clinical staff in an agency required to complete? So this came in from Jacqueline Phyllis. The trainings that are a part of the network provider training are available, and they are to be completed by June 30th, 2018. In terms of all clinical staff and their requirement to complete, what we've been communicating to the agencies is that this is not required. This is basically required for behavioral health managed care providers, and we've left it to the discretion of the supervisor or the agency leader to designate which clinical staff may benefit from accessing some of these trainings. But the idea in collaboration with the state partners and the Health Plan Association is that these trainings be completed by June 30th. Okay. We also have a list of topics that we have been interested in terms of curriculum development, and we'd like to have, Nancy, if you can put the poll up for us, we'd like to have our audience also respond to the poll that we've developed here. It includes some topics that are responsive to some of the state managed care plans, as well as with seeking some input from our provider community. We've put together this list. We'd like to invite the audience to respond to the polling question, and we'll just give you a few minutes as we look at the results and they're coming in. Okay, and so it looks like in terms of our topics that we've listed here, psychopharmacology is of great interest. Working with individuals using K2, recovery, cultural competence, and trauma-informed care. These are all such important skills for providers within agencies to know about. And some of these are also specific to certain types of providers, as in the case of psychopharmacology. I see medication-assisted treatment. And what we can say about the medication-assisted treatment, and Marcus, please feel free to join me in this conversation, but throughout the first 3 parts of the network provider training, there are specific modules related to medication-assisted treatment through the ancillary services, stabilization and withdrawal videos that we have as part of the network provider training series so far.
Yeah, I would say just that MAT is a very important topic and a very necessary one in terms of training, particularly when you're talking about SUD and when you're talking about delivering services. So to be knowledgeable about MAT and how it's incorporated in service is very important, particularly SUD.
Great. We also see suicide prevention. And also to point out to our audience that within our learning management system, we have, our network provider training resources, and we also have a wide range of other clinical core competencies and evidence-based practices, one of them being suicide prevention. And we do also include suicide prevention as one of our core topics as part of our network provider training series so far that's available within the learning management system for this training. So I just want to thank everyone for giving us your feedback on the poll, and we're certainly carrying forward what we're hearing from you and sharing this with our state partners and with our Health Plan Association partners to make sure that the curriculum development that goes forward from here takes into account some of the needs that you all have shared with us today. So thank you very much for that. I'd like to move on to reporting. And so I think, Tom touched on this earlier, which is that, we're really interested in being helpful to both the agencies and supervisors that are interested in knowing about their clinical staff and the types of trainings that they've been participating in, and to help, possibly support internal continuous quality improvement around particular training priorities and competencies that you'd like to embed further within your organization. So one way we think in which we may be helpful is to provide both program supervisors or agency leadership with reporting. And the slide that I've put up right now summarizes some ways in which these reports may be available to either the program level supervisors or agency leadership. And a number of ways in which the data can be summarized is that once you've designated yourself as either a program supervisor or an agency leader, you may have access to the Learning Management System dashboard, the LMS dashboard. And in the LMS dashboard, this slide shows how you are able to access real-time data. So this data is refreshed every so often, and it can be refreshed at any point in time, and you'll be able to visually sort of get a snapshot of what's happening within your agency, and then also have some basis for comparing to the agencies and programs that are participating throughout the state. So if you just take a minute and turn your attention to the pie chart that's on the right, this summarizes the data that's visually displayed that's a within agency snapshot. So you figure if you're a program supervisor or an agency leader, you want to know how many of your staff or your providers have completed the training. So this will give you a snapshot of how many have completed, how many that you have assigned and are past due, or how many of your staff are in progress, so they're working towards completing either parts or a full curriculum within the learning management system for this training. And on the left, you'll see a pie chart which actually gives you a sense of the metrics in terms of completion of training, past due training, or in progress for all of the participating programs or agencies. And so it really gives you a sense of that comparative view of how your agency is doing compared to some of your peers throughout the state. And all supervisors, either of a program or of an agency, will have access to this LMS dashboard. And so, to answer the question that came up before, if you designate yourself as a program or agency leadership, you would have access to this in addition to assigning the training and managing the ways in which you would like to have the training assigned as well as reported. So what I'd like to do next is just to take a couple of minutes here to hear from some of the agencies, and we're very grateful for their participation. We here at CPI and CASA have been calling them our champions and our early adopters when it comes to this training. They have had a good proportion of their staff and providers at their agencies participate in this training, and so we'd really like to provide the opportunity for them to talk with us and all of you on the line today about how they've used this training. And I'll turn it over to my colleague Andrea Cole to introduce both of our agencies that are with us today. Andrea?
Thanks so much, Sapana. So first, I'd like to welcome Eileen Sunshine, who is the Director of Behavioral Health at Bridging Access to Care in Brooklyn. And again, we've invited her here today to tell us about her organization and share a little bit about her experience with the training.
Hi, thanks so much. Bridging Access to Care was originally known as Brooklyn AIDS Task Force, so some of you may remember us from that name. We started about 25 years ago. Currently, we've evolved, and we have a Article 31 mental health clinic and an OASIS 822 Article 32 clinic. And as the Director of Behavioral Health, those are the areas that are sort of under me. So I'd like to say that I just love the Center for Practice Innovations. Not just this training, but I use all of the trainings that they have, particularly the IHAT for co-occurring substance abuse and mental health certification. I love it. So with this training, what we did is we took it very seriously, and we decided that we would make it part of our orientation process for all new staff. We also have a clinical internship program that runs through our clinics. So this was an excellent way for us to help build the foundation of their work with our clients. We also, it's a little bit of a struggle because we had to make sure, forgive the train that's going by. We also had to make sure that we gave a little bit of time on the clinician's schedule to allow for the training. So for staff who were full-time employees, who are actual employees of the agency, we allotted some time within their schedule. For staff that were consultants, our fee-for-service staff, we did not allow time, nor did we pay them for the time. We simply made it a condition of their employment with us that this was a foundation that anybody who works with us would need to have. So they had to complete that on their own time. One of the things that I did do to sort of sweeten the deal is when there's a particular training that I really want to make sure gets done really quickly. Sometimes I can scrounge up, a small gift card, $25, $50, and I'll say, the first 3 people to complete it, may be able to receive a gift card. And so I've done that when I've wanted something done particularly quickly, especially since I'm not paying staff to do it in their fee-for-service. So I've done that. It's a particular favorite topic that was really great that we got a lot of feedback from was the intervention and prevention of suicide behavior. That was a particular favorite that really resonated with us here at the clinic and with staff, so that was great. But it's really been really good. It was great for us to be able to fold this into our orientation process. What we hope going forward to do, and which we haven't done yet, is also incorporate discussing the trainings in our team meetings. So after, the deadline for taking a particular series of trainings, that we'd put it on the agenda so that we could actually talk about the trainings and see if anything came up, so that it would help bring the trainings alive a little bit and more meaningful for staff as a discussion topic. So that's pretty much where we're at.
Great. Thank you so much, Eileen. Those are some really good ideas for how to sort of integrate the training into your workflow, or how to motivate staff to complete the training. So I really appreciate that. So next we are going to hear from Meredith O'Boyle, who is the Vice President of Behavioral Health at Bailey House in Harlem. And again, we've invited her here to tell us a little bit about her organization and share her experience with the training.
Hi, can you hear me?
Yes, we can.
Okay, good. Just making sure. So we've had some very similar experiences to Bridging Access to Care. We started out, Bailey House has been known primarily for our HIV care, but in 2013 we opened up our OMH clinic, and just this past February we opened up our OASIS program. So we also love all of the CPI trainings. I think they're great. And we really use this as part of our onboarding and orientation process for all new staff, but also for seasoned clinicians who've been with us for a long time. We really wanted everybody that's in both of these programs to experience the same trainings. So all of our staff, except for our prescribers, take these trainings. So our program directors, LMSWs, LCSWs, LMHCs, LMFTs, CASACs, as well as our interns, complete all of the trainings as well. What we really like about it is they're free, obviously, which is great. And when I assign the trainings, staff can do them self-paced. So we don't allot specific time for the trainings, but if they have a no-show or a gap in their schedule for the day for some reason, or maybe on a lunch hour, they can complete the trainings on their own time. And I haven't had an issue with the staff not completing them, which is good, and I usually try to give them a deadline of a week or two, or depending on their schedules, maybe a little bit longer. But they've all completed them, and we also found that the suicide risk factors training was really good, especially for the newer clinicians or for the students who are coming on board who are new to the field. And for those in our OMH program who might not have been as familiar with ancillary withdrawal services, we found that those were really, really helpful as well. You know, I think like the poll suggested, we're also more interested in hearing more about psychopharmacology, the different street drugs that might be happening, or especially with the K2 and things like that. And, you know, we just really enjoy these trainings, and we also incorporate them into clinical supervision, things like that. We haven't discussed them necessarily, I think, as a full team, which I would like to do, but it is incorporated into everybody's individual supervision.
Great. Thank you so much. It seems like you found a lot of, advantages to using these trainings.
Definitely.
Great. Thank you. So, again, we really appreciate you both taking the time to reflect on Uniform Clinical Network Provider Training and how you've used it at the agency. I think it adds a lot of value. So now I'm going to pass it back to Marcus.
Okay, great. Thank you, Sapana, and thank you, Eileen and Meredith, for your discussions. Very helpful. Okay, at this time, as part of our concluding the webinar this afternoon, I'd like to open up for any additional questions or feedback from our audience that you may have. And again, you may use the chat box function, and we'll give you a few moments for your responses. So thank you.
Thank you, Marcus. So we'll give folks a few minutes to type in their questions, and I just want to sort of highlight a few things that I heard about. It definitely sounds like there are several ways in which this training can be, sort of assigned within organizations, and we've heard about great ways in which both Eileen and Meredith outlined how they've used this as their organizations. And there's one important point that they've been touching on throughout all of this is that that there is incentive necessary, and we hope that in some of the continuing education and in really providing a portal for us to communicate with the agencies, that you'll continue to let us know about ways in which we can be helpful with implementation support. It sounds like there are opportunities to, do supervision. There's opportunities to have staff meetings devoted to some of these trainings. So we encourage your feedback. I do see that we have one question. So as the supervisor who will be assigning the trainings, we take a survey and then we're able to assign trainings to staff. Is that how it is done? Yes. So what I'd like to do is invite my colleague Nancy. Nancy, are you on the line? I think she's answering the question right now.
I just did put something in the chat box.
Great.
So you can either direct staff. If you want to assign it with a due date as a supervisor, you have that capability, and once you have a login to the system, there's a whole section of supervisor resources that walk you through how to do that. Alternatively, you can just tell your staff to please take the training through that network provider button that Sapana showed earlier.
I think we also had a question from Mary Peterson. Is this required for supervising CASACs? Do you know? Marcus, would you like to respond to that question?
Sure. From my knowledge, it's not particularly required in order to supervise case acts, but it can definitely be helpful to supervise case acts. So any of these trainings in terms of the content would be extremely helpful in your supervision of case acts or anyone in addictions. So it's particularly helpful for supervisors. Great question.
So the next question is, if my agency already uses the learning management system for other trainings, do I need to take the enrollment survey again? And the answer is no. If your agency already uses the CPI LMS, you may go directly to the home page and access the Uniform Clinical Network Provider Training button to access all of the trainings. And your participation will be recorded both for you and your staff on our learning management system backend. I also want to invite questions that folks might have for our early adopters, for Eileen and Meredith, or to our state partners. We also have our Health Plan Association partners on the line, so I would say that if there are any questions that are specific to the training or are sort of more general questions, we're all here to address them with you all today. So I see another question. Is there contact information for a help desk that we may contact in case of any issues? Yes, and we do. I see that Nancy is responding. We do have a help desk, and this is their address. I'll also, as we conclude, I'll also be providing you with information to contact both myself, Marcus, and Carla Licio, who represent CPI and CASA as well, at the end. Okay, so I see a new question. What happens if I take a new job at a different agency? So any trainings that you take as a provider will be a part of your transcript in the CPI learning management system, and so your transcript follows you from agency to agency. So there will be a record of the trainings that you've completed. To answer that question. Okay. Okay, we'll just keep the chat open for just another minute. Okay, so I see, what if as a supervisor I've not received the self-registration link from CPI? So in that case, if you've not received the self-registration link from CPI, the idea would be to contact the CPI help desk at the address that Nancy had posted earlier on in the chat box. cpihelp@nyspi.columbia.edu. Any other questions from folks who've joined us? Questions about the curriculum, topics, reporting? Okay, so we're going to close the chat box, and I'll end today by just, sincerely thanking all of you for joining us. We have listed on this last slide here some email addresses that you may use to contact us with any further questions that you may have. Please feel free. There's no question, big or small, that we aren't here to help answer. And so I'd just like to invite Marcus, if there are any last comments that you have from CASA, and on behalf of CPI, I'd just like to thank you all for joining us today. Marcus?
Sure. Thank you, Sapana. I'd just like to thank everyone for joining the webinar today. I hope it was informative, it was informational. And if you have any questions, please feel free to contact either Carla or myself here at CASA, and we'll be glad to assist and answer any questions that you may have. Thank you.
Thank you, everyone. Have a good afternoon.